So how evidence-based practice can help with chiropractic. Obviously, the three pillars: the evidence and based practice. That's the research, it's the clinical expertise, and it's the patient experience. As far as the best research out there goes, there's multiple schools, there's multiple techniques. This can lead to a lot of research, but it's not a lot of in-depth research based on the techniques. Well, some of them there is a little bit more. There are some techniques that are not very well researched for outcomes, or there's a very biased research. Um, this makes it hard to justify whether it's a good technique or not a good technique. Um, I think there's a lot of room to be done for evidence-based practice as far as the research side goes for chiropractic, um, especially when it comes to some schools and some people believing the advancement that it can do for people's health, not just some help with muscle discomfort or joint motion increased, but when some people are saying it can help with, improving this disease, or if you have this problem, it'll get rid of it. Um, those aren't really evidence based. Those are, it, to me, it seems like anecdotal experiences. And while those are important, it doesn't mean that it's truly based in evidence. It's two, three people did it, it worked. Uh, so there's a lot of room to be done as far as that goes. The clinical expertise, that's where the anecdotal stuff comes into play. Um, People have been doing this for 20, 30 years, and they see a lot of people improve with certain conditions, and we call those the perfect chiropractic patient, the typical chiropractic patient. Um, the diagnostic skills that every clinician has and gains through school, through the first couple of years, and then through the whole career. Um, with that evidence that you have, because you have so much anecdotal experience, you have so much clinic experience as a provider, to know that if someone presents with a certain amount of symptoms, that this is generally what's going to happen with it. I see a lot with sports. I'm a sports chiro by nature. Um, and sports injuries have a pattern. If a patient presents with a certain amount of issues and they describe them a certain way, it helps me get a better idea of what's happening without having to go through a million different tests. If someone says they feel like a sharp pain going straight to the shoulder from the back to the front, it helps me go down to a couple of different muscles instead of saying, oh, it's a whole shoulder. Which one can it be? My clinical experience helps me get down to two or three right away, and then I do my test from that point. Um, and then the patient values and preferences. I always tell people, if you've ever been to a chiropractor, you let me know what you like or don't like. That's going to dictate how this goes. Because if I do something you don't like, because you've been to a chiropractor before, you're not going to like, either you're not going to come back to me again, you're not going to like the experience, you're not going to get the results we want. If you've never been to one, keep in contact with me as far as if I try something one day and you don't like it, let me know and I won't do it next time. Or if you loved what we did, let me know and we'll do it again. If you think that that gave you the most relief that you've ever had, or you felt good for 24 hours compared to 6 hours, whatever it happens to be, if you're enjoying the treatment, that's going to help us continue getting the outcomes that we're looking for. Um, so that's how I think evidence-based practice, as far as the chiropractic side, can help um, discuss specific scenarios or contexts where you foresee employing evidence-based practice every day. I don't think there's a specific scenario. I think if you're not doing it every day, you're doing a disservice to your clients, your patients, especially as a chiropractor. You always have to be going off of what the evidence says, what the patient believes, and what you know. If you're just guessing at every patient, you're gonna do a complete disservice to them. They're not gonna get better. You're just taking their money, and that's I don't believe in that as a provider. I didn't get into healthcare to take someone's money and to guess around with what's going to help them. I got into this to actually make a difference for them. So I always go into every patient encounter with those three pillars. What does evidence say? What is the what does my experience say as far as the injury goes? And what does the patient prefer? What are they telling me? If the patient's not telling me something, I'm not going to do it. If they are telling me something, I'm going to listen to them. They know their body better than I do. Just because science says it should be this, and the what they're describing says this, they are their own person. I still have to take into account what they're saying. They're not the textbook. They're not the patient I saw 10 minutes ago. Not the patient I'm going to see next. They are their own person, and I need to take into account that as well. Consider the challenges or opportunities you anticipate while implementing EBP. The biggest challenge is that everyone's different. Healthcare is such a hodgepodge of information that's always changing. You're always learning. It's always growing, especially with chiropractic when there's so many schools teaching so many different things with so many different adjustment styles, so many different techniques and beliefs. It's hard to get true evidence out of that when there's so much out there and people aren't willing to focus on one or two or three different things. They're focusing on multiple. And that's the biggest challenge then is finding what evidence truly is good, what evidence is truly backed by the proper research, a double-blind study, or the least biased studies out there. Um, so you have to sift through that information a lot. Uh, I think that's the biggest challenge as far as using EBP, as far as chiropractic goes. Is just there's so much out there for clinical experience that doctors have had before, but it's not as studied with the techniques because some of them, in my opinion, aren't great techniques. I don't think the evidence is there to make them a great technique, but yet they're still used because a doctor had success with 5 people. So therefore, it must work. Um, do I think it's right or wrong? I don't think it's right or wrong. I just think that's not for me because I want to use more evidence, true evidence in my practice. What does EVP mean to you, and what do you perceive the fundamental goals within your field of study or practice? EVP just means using the best research out there, the best patient information I can get, my best experiences. I don't want to use a biased experience, but I use my best experience. So if I've seen 50 shoulders, I want to use all that experience, still treat the person as an individual, but know that if they're saying a certain issue is feeling this certain way with these certain movements, I want to be able to take that into account with I've seen 25 of these. This is what they generally look like, but then still treat the patient as an individual. Let them tell me how they're feeling, the things that they feel, the motions that they can and can't do. But then also use the research saying this is what it should do, this is what it's not going to do. So it's taking all the pillars daily into every patient interaction. Share potential instances or areas where EVP can be applied for your future career. Um, as a chiropractor, it's applied every day. There's not a day that you shouldn't use EVP with your patient care. If you're not using EVP with every patient every day, you're doing a disservice to your patients, and that's a big flag to me. So I try to do this every day. Some patients are easier; they might be in the middle of a treatment plan, so I'm not be using every single research article every day with that person. But to start the care plan, I definitely did. I went through articles. I went through their history that they told me that they're feeling. I went through my own Rolodex of cases to create the best treatment plan. But then I always revisit. Every 5 to 6 visits, I'm checking in, being like, how's it feeling? What are we doing? How's outside care going? Are you doing the treatment plan to the fullest? To continue to use that EVP. I do want to start going back to school, to med school. So I think as far as using EVP as med school, always using research. Medicine is always advancing. Sports medicine is always advancing with different surgeries, protocols, rehab. It's always advancing. It's always engaging. So again, I think if you're not using EVP daily, you're going to do disservice to your future patients.